Welcome, my name is Erlene Diaz, and on behalf of the Health Information Technology team at Healthcare Authority, we thank you for joining us on learning more about the readiness activities for participation and getting started. This video is for provider organizations that are required to participate in data submission to the Clinical Data Repository, or CDR, by February 1st, 2017. I'll be walking you through the registration process with our technical partner, OneHealthPort. But before we start, we have other videos available in case you missed them, located on our website at www.healthit.wa.gov. If you're not sure if you are required to participate in data submission, please watch the video Decision Tree Data Submission Requirement. Now let's get started. The first step is to visit OneHealthPort at www.onehealthport.com/HCA_CDR. Once you land on the splash page, there will be 4 steps to help you prepare for your participation in the CDR. If you're not already registered with the OneHealthPort Health Information Exchange, or HIE, we will go through steps 1 and 2 first. If you are already registered with the HIE, please refer to only steps 3 and 4. Please note that each step does take time to review, process, and complete. The time required to complete each step could vary substantially depending on your organization's contract management process, EHR vendor relationship, and how familiar you are with clinical data exchange. In steps 1 and 2, there are a few things of note: the OneHealthPort CDR information, the Readiness Activity Survey, and the HIE contract. In step 1, you will review the OneHealthPort CDR information, and to view this document, you will need to click the OneHealthPort CDR information link. This information includes details on consent, access, and data classification on the use of the CDR. Please note that you are responsible for understanding and sharing this information with individuals from your organization that will use the CDR. After reviewing the OneHealthPort CDR information, you will take a readiness survey. The kind of questions you'll see on the survey are whether or not you have a certified EHR system, gauging your consolidated clinical data architecture or CCDA exchange capability, your connection to others to share clinical documents, and your services to Medicaid patients. By completing the survey, this will measure how ready your organization is when you begin the process to submit data to the CDR. When you have completed the readiness survey, you can move on to step 2, the OneHealthPort HIE contract. To participate in the CDR, you are required to sign a participation agreement and pay an annual subscription fee to the OneHealthPort HIE. You can learn more about the HIE fees by clicking this link. Please note that if you are registering to the HIE for CDR purposes only, you will not be billed until data submission to the CDR begins. By clicking Contract, you will find another set of steps and requirements to complete your participation agreement through online contracting. First step is to review the OneHealthPort HIE participation agreement. This document provides more detail on the pricing schedule, Secure Hub services, participation terms and conditions, business associate policy, HIE user policy, and security policy. Also available to you is the OneHealthPort HIE operating manual and another opportunity to determine your annual HIE subscription fee. Please note in step 3, you are required to identify a person from your organization to obtain a OneHealthPort single sign-on subscriber ID and be assigned as an administrator to access online contracting. When you have obtained a single sign-on, please click this link to review the requirements for online contracting. When you have successfully registered with the OneHealthPort HIE, you can move on to step 3. For this step, you will have to contact your electronic health record or EHR vendor to prepare and test your CCDA files. To learn more, you will need to click on Get Started with CCDA Exchange. You will be taken to another page titled HIE Trading, where you'll receive more information on getting started with CCDA Exchange. On this page, you will find the following resources for CCDA submission. A CCDA implementation guide is available to share with your EHR vendor regarding CCDA specification information. A guide on One HealthPort object identifiers is offered to learn more about the assigned identifiers in CCDA messages sent through the HIE, and CCDA validation testing instructions to prepare you for CCDA exchange testing. Once you have reviewed all the documents and are ready to test verification of the CCDA data in the CDR, submit a One HealthPort HIE support request form. You'll also submit the same form when testing is validated and you're ready for CCDA message submission through the production environment. After successfully testing the CCDA compliance, you are required to contribute provider information to the One HealthPort provider directory for Step 4. This information that you'll be providing will populate to the CDR. To learn how and the benefits of this directory, please select the One HealthPort provider directory link that is available in Step 4. This link will take you to another page, and you can find the implementation guide for electronic data submission titled One HealthPort Provider Directory. You can request access to the provider directory through the HIE application portal through this link. Along with your request, you will need your One HealthPort subscriber ID, a One HealthPort HIE contract, and a CDR access role assigned by your administrator. Hopefully this walkthrough was helpful, but remember, when you do visit the One HealthPort site, read all the information in each step provided on the page as you work towards meeting the data submission requirement. If you do have questions or need assistance with onboarding, you can find the One HealthPort HIE support request form on the One HealthPort website. On this form, you will complete all the fields and select Onboarding a New Trading Partner. For more information and videos as we progress through the Washington Link for Health project, please visit our website at www.healthit.wa.gov, or if you have any general questions about the CDR, please send us an email at healthit@hca.wa.gov and put CDR in the subject line. Thank you again for joining us, and we appreciate your participation in this effort to improve the coordination of care in Washington.